Although Jubail Specialist Hospital first opened its doors as a 10-bed facility located at Community 13, Sakumonotema, in September 1996, the hospital has a very inspiring history dating back more than 45 years.
As a medical student, I had always had the feeling that I would want to start my own clinic one day. And that has been my motivation whilst I was in Ghana and whilst I went to the United Kingdom to further my education and also to work in Saudi Arabia.
And when we came back to Ghana in 1990, the project started.
We acquired the land in 1993 and it was quite very disturbing and discouraging when this plot was given to us.
It was a hassle getting the plot of land from TDC. After several visits to TDC, the land was eventually demarcated, and it was in a very distressing and discouraging state, meaning sands and stones had been weaned from the land, and there were about 9 bunkers which had to be filled. And the only high ground, which I call the hill, is where the hospital, the original building, is standing now.
And because we had to start the building, we invited Reverend Ofoirai to come and help us to dedicate the place to God before we start. And he was the one who encouraged me and said, the plot looks like bones without flesh. And he prayed that God will put flesh on the skeleton.
One may ask, why the name Jubail? To the founder, Dr. Kofi Aminyampong, it holds very sentimental value.
The name Jubail is a very sentimental one. During my sojourn abroad, I ended up in Saudi Arabia, and I worked at a city called Jubail. Jubail in Arabic means a small hill. And in 1990, whilst I was there, that was when United States of America had the war with Iraq. And my house was just behind the airstrip where I was working at the Jubail Naval Base Hospital, and my house was the last building to the airstrip, and I could observe all the things that were going on behind and within Saudi Arabia and in Jubail itself. And that was a very trying moment in my life, where we faced death every day because of the war. So I returned to Ghana in 1991, and the name, I thought that it is a very sentimental. I didn't want to forget about what happened in Saudi Arabia, and that is the reason for the name Jubail.
A sword-cutting ceremony was held in 1994 after the land for the project was acquired. The construction of the first phase commenced immediately and was ready in 1996.
We started as a general clinic, though I was obstetrician gynecologist and were running both the obstetrics and the gynae clinic. But as the years went by, we had to open up. And the fertility center was opened and the laparoscopic center was opened in the year 2007.
The early stages, accessibility to the place was a nightmare. We had to use several routes, blind routes, to get to the place. It was so bushy. Getting patients to come to the hospital initially too was a nightmare because they couldn't even find their way.
The vision of Jubail Specialist Hospital is to be the preferred health institution for specialist care in Ghana with a reputation for innovation, privacy, and utmost quality of care.
I happen to be one of the pioneer board members. I started serving on the board in 1998. It was chaired at that time by the late Mr. Uswechan, a renowned entrepreneur.
Jubail is, for starters, is a private hospital. Ghana's health service has the public service. It has faith-based services. It has quasi-public institutions, and it's got the private sector.
I can confirm without doubt that Jubail Hospital is patient-centric. And that is because they have a solid coordinated effort when it comes to healthcare.
25 years on, Jubail Specialist Hospital has provided health services to over 50,000 individual clients dotted across Ghana and neighboring West African countries.
One thing I would say about Jubail is their services. I think the welcoming was very good. The reception was very welcoming compared to other hospitals that I visited.
In the mid-90s, I used to live in the neighborhood. And so I was living with an auntie, and I was bringing her children to the hospital, either for malaria, for injury, for stomach ache, and other ailments. I was fascinated about the services here. And I also got to know during those times that they offered antenatal and gynae services. So later on, when I got married and I got pregnant, I opted for Jubail because I was very impressed with the services that Dr. Ameniampong and his team offered at the time.
Management and the staff are all friendly, and we enjoy their service. They are very honest and open up, and where they have to refer you, they refer you. And we realize that they are concerned about our total well-being.
The service there is brilliant, the customer care, and the doctors are all of very high standard, the nurses and everybody there. So both sides, the experience has been really, really good, I must say.
When I was coming here to have my last child in 2008, it was tough, but with the vigilance of Dr. Ameniampong and the other nurses in charge, they were able to detect that it was a crossed child, a breech child, and I had to be processed for surgery as soon as I started labor, and that was a good experience, and I thank God for that. I had my baby, and I'm here, and I'm grateful for all that they've done.
The facility boasts of medical practitioners and staff who have contributed to the success of the hospital.
I'm very happy to see a mother giving birth to a healthy baby and seeing a very happy family living Jubail at the end of our services.
Because Jubail is also a fertility clinic, sometimes you are going to come across couples that are unable to conceive or having difficulty trying to achieve the pregnancy. So when you assess them and finally arrive at that goal, you give them that chance and they're able to pick up the pregnancy and they conceive. And that joy of the childbirth, it's usually a memorable one all the time.
There are times that you are called late in the night to attend to an emergency and you have to quickly rush because we are here to save lives.
So we've been able to run various tests for the clients and also promptly releasing results for the utmost care of the patients.
What puts a smile on my face is when I see the nurse-patient relationship.
The greatest joy that I get as a nurse is to assist patients alleviate their pain and then bring smiles on their face.
What puts a smile on my face at the end of the day is to see my clients happy.
Some remarkable accomplishments at Jubail Specialist Hospital are the provision of IVF services, pioneering gynecologic laparoscopic surgery, and being the only health institution in Ghana which provides sperm DNA fragmentation test.
It's indeed one of the first IVF in vitro fertilization hospitals in this country. And the hospital is in fact the first to have conducted a gynecologic laparoscopic surgery and sperm DNA fragmentation.
Jubail started the IVF procedure in 2006 with the aim of helping families that were saddled with childbirth issues. And to the glory of God, as of today, we have 350 successful childbirths. You know, and it brings a lot of joy to us because we have been able to put smiles on the faces of at least 350 families. And that is an achievement.
Over the years, we've seen that it is important to bring in the children's component. After all, if you have a fertility problem and, Jubail is able to nurture for you to get a baby, then it is important that Jubail also takes care of the child. So, child care has now also become a very paramount fit into the Jubail portfolio.
Jubail Specialist Hospital currently provides several medical services such as General Medicine Clinic, Physician Specialist Clinic, Surgical Specialist Clinic, Pediatric Specialist Clinic, Urology Specialist Clinic, Fertility Specialist Clinic, In Vitro Fertilization IVF, Obstetrics and Gynecology Specialist Clinic, Prenatal Antenatal Care and Delivery, Gynecologic Laparoscopy Surgery, Family Planning Clinic, Immunization Clinic, Laboratory Services, and Pharmacy Services.
Jubail Hospital has come very far because now there are enough staff. Patient attendance is adequate, though not many, but we are getting our share of the cake.
And beyond Tema, it intends to establish a branch in Kumasi, in Ashanti, to cater for its customers in Ashanti, in the northern sector of the country. In fact, that branch will also be responsible for clients coming from the Sahelian countries of Burkina Faso and Mali, who are very much aware of the existence of this hospital.
Another 25 years, we think we would have grown in leaps and bounds. I wish the management and staff of Jubail Specialist Hospital the very best. They've done an awesome job, and I think that the next 25 years will be even better.
I envisage that the next 5 to 10 years, Jubail would have built other additional centers here, including ophthalmology department, dental unit, ENT center, and then the radiology center. This is what we envisage that within the next 5 to 10 years, we would have been able to set that up.
To our valued clients, we say thank you for choosing Jubail. Your constant feedback has helped us to become better at what we do.
I wish them God's blessings. The work they've started doing, they should continue. And their confidence in God, especially with the director, they should continue. I think that this is not a handwork of man, but the intervention of God.
If there's a story to be told today, it's because Jubail has had an army of happy clients, dependable partners, and dedicated staff to count on.